Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health Systems. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. J. Evan Devillier of Aultman Alliance Family Medicine. Good morning, doctor, and welcome to the show.
Morning. How are you?
Good.
Wonderful. Okay, Aultman Alliance Family Medicine of Aultman Hospital has 3 physicians, 3 certified physician assistants, and 2 certified nurse practitioners. The group has more than 40 years of combined experience. Dr. Devillier is with us today to answer numerous medical concerns for men. So let's get started. We'd like to remind you that our program is available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
Welcome to our show, Dr. Devillier. Please tell our listeners about yourself and your role with Aultman Alliance Family Medicine of AOH.
Well, thank you, and I appreciate the warm welcome. So I am one of the newer physicians with the practice here at Aultman Alliance. Our office is connected to the hospital in Aultman Alliance, just at the corner next to the Rite Aid. My job here is a primary care physician. I am an internist in a family practice office, so most of the physicians will see the full range of health conditions from infancy all the way through to late adulthood. My training has been specifically in adulthood from the ages of 16 on up, and I have a lot of training in critical care issues as well.
Are you a local Cantonian or are you coming from another part of the world?
I am from another part of the world. It almost feels like a different country at this point, but I'm from South Louisiana.
Oh my gosh.
Yes, sir.
Lots of perspiration down there. Gosh.
Especially this time of year.
Oh my God. I've been there a few times. Yeah, it is really something in the summer. Wow. Crazy. I rode the trolley too.
Oh, well, there you go. I
It's
take it you were
still,
down in New Orleans?
yes, sir. I am down that
Yes.
way several times. So
It's always an
anyway,
interesting trip.
for sure. So why is it important for men to get an annual wellness exam?
So, one of the things that we worry about in terms of men's health is just getting in for at least an annual exam. The biggest thing with men's health is we tend to put off things as men. And
Yeah.
if it doesn't cause a debilitating or a very noticeable symptom, we just kind of let it go as it's not there. If you don't see it, it's not there, kind of thing.
Yeah.
So it's important for us as men to get in once a year, get checked for all of the routine things like your cholesterol, your blood pressure. Up here, it's important to be screened for vitamin D deficiency because vitamin D will help to build our healthy bones, and it's a healthy part of creating the blood we need on a daily basis and making sure that our body just runs quite well. And one of the big things I've noticed here is during the winter, it gets so cold, we're kind of hiding inside. We're not getting that sun exposure that helps us to create this. And so up here, it's a lot more prominent to get that vitamin D deficiency that we notice.
Very interesting. At what age should men start being seen by a doctor for an annual exam?
So it's very important that by the age of 18 to 20, you start coming in for at least an annual exam because you want to check things that are going to be silent that men and most people in general just will not notice. So most of the time when you start getting high blood pressure or high cholesterol or your sugars start getting out of control, while it's in those early stages, they are very silent. You don't notice a lot of symptoms, but you can catch that at your routine annual wellness appointment because we're going to take a full set of vitals. We're going to get labs once a year just to make sure that we can stay on top of things.
Interesting.
So what kind of lab tests do you run for an annual visit for a man?
So it'll change throughout the spectrum of life. So 18 to 20-year-olds, we'll go ahead and we'll check things like the kidney function and electrolytes. We'll check to make sure there's no anemia. We'll check to make sure that there's no elevated cholesterol. And part of that, we'll look at the sugars, the blood glucose, to make sure that we don't have just an outstandingly high glucose that could indicate early onset diabetes. All of these things are very silent. So in the 18 to 45-year-old crowd, it's important to get that done on a yearly basis. Then once we start getting into the 45 and over crowd, we start looking at colon cancer screening, especially if there has been a family history of colon cancer. Um, Once we start edging up toward this 65 and older crowd, we start looking at other notable vaccines that are needed, like your pneumonia vaccines, your shingles vaccine. We start looking at screenings for different types of cancer. So if you were a smoker when you were younger, it's important to get lung cancer screening by the age of 65 if you were a heavy smoker. It's important to look for abdominal aortic aneurysms. So those kind of things hit in that 65 plus crowd.
Jeez.
You know, just as an aside, I had a patient come in the pharmacy. It's been about 3 weeks ago, but she has a teenage child, a boy, and I think he was 19, and he had a doctor visit, and they discovered he had high cholesterol. Are you seeing younger men, or even just younger patients in general? I know we're talking about men's health today, but are you seeing a lot of younger people with higher cholesterol or lab values that concern you based on lifestyle, or what trends are you seeing that maybe it's as important to not only remind people we need to see the doctor once a year, but also don't discount the fact that because you're young, you're automatically healthy?
Correct. Then that's the biggest thing, is not to discount that because you're young, you're healthy. I have been seeing a lot more younger patients with concerning cholesterols, concerning blood sugars, higher elevations in blood pressure than we were used to seeing. And then now lately, with a lot of the energy drink consumption that's been so rampant, we see a lot of arrhythmias that'll pop up because it's just so much caffeine in the system that a lot of people will have some kind of arrhythmia.
Wow.
That's something.
Okay. I was actually fascinated to learn that some of those drinks are banned by like NCAA and Olympic events and things. And it's just, I don't know, I'll never forget. And I promise not to digress anymore after this, but I'll never forget a guy that I met years ago who thought just because you could buy an over the counter medication like Tylenol without a prescription, that it's perfectly safe and you can't overuse it. So just, thinking about just because you can have a cup of coffee or a Monster energy drink doesn't really mean you should, but moderation for everything,
Exactly.
right?
Exactly. And just because we can do it doesn't mean that we should do it. And that's another thing, too, is it's important to look at kidney function, because as we're younger and we're working out and we're moving more, if we're taking things like ibuprofen over the counter to help us recover and not drinking enough water and staying hydrated, that puts a hard toll on the kidney and can start to damage the kidney. So that's another big thing to look at.
Are there other routine things or appointments that men should regularly get?
Yes, sir. So I'd encourage everyone to be seen by an eye doctor, whether it's an ophthalmologist or an optometrist, at least once a year, because vision will change slightly over the lifetime. And we want to check and make sure that things are being looked after, because our eye doctors can often see things that give us an idea of, if you're not going to a primary care doctor such as myself. I've had eye doctors refer patients to me because they're seeing signs of high blood pressure, high cholesterol, diabetes when they're doing that retinal exam. And that all is getting a patient in earlier. So it's important to do that. And then dental health is so important. So it's important to go and get your teeth cleaned at least twice a year. Dental health is connected to a lot of our overall health and our gut health. And so it's important to make sure that that's well taken care of.
A lot of things start at home, if you will. What are some things that any man can do on a daily basis to, improve overall health and put health and wellness in their favor?
Yes, sir. So the biggest things we can do at home to help ourselves are to get routine exercise. That's one of the biggest things is routine exercise and watching what we're eating. We want to moderate the amount of things that aren't that good for us. So fried foods, fast foods, sugary foods, a lot of carbohydrates, while they are okay in very slim moderation, we want to make sure that we're not overindulging in those things, because the fact is that if you're eating out a lot and you're eating a lot of fast food, it's got a lot of salt to it, which can in turn cause you to retain fluids. It can cause your blood pressure to elevate. And a lot of what we don't realize is even in these fast food salads, they're sneaking sugar and salt into it in the dressing. And that adds extra calories to our diet, and it adds extra things to us that aren't good, and it can damage the liver long term. Another thing we can do on a routine basis is it's summertime. Everyone wants to get out, go gardening, go play golf, go for a walk, go on the rivers, go fishing. It's a beautiful time of year, but sunscreen is important. Most men just neglect it and take the burn, but that's not something good long term, because that leads to skin damage. So if you're going to be outside, make sure that you're wearing a hat, make sure that you're wearing an appropriate level of sun protection for your skin tone and your skin type, because those are things that will help in the long run with not only just the aging process, but with cancers. Wear sunglasses if you're going to be outside in a bright environment, because that extra reflection off of pavement, off of water, can actually damage the eyes.
Wow. I'm thinking we're on our first break. Is that correct, Brad?
We are.
Okay. Time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to our pharmacist about Health Matters membership savings program. We want to help you stay well and save money. So, Doctor, what vaccines are important for men to get, and at what age should they get these vaccines?
So throughout the life, and more importantly, earlier in the life, it is very important to make sure you're up to date on your tetanus vaccine, especially if you're working in a manual labor field where you're exposed to metals and woods and you're working with those kind of objects, especially if they could be dirty or contaminated. Um, Cuts, bruises, scrapes, things happen, injuries happen, and staying up to date on your tetanus vaccine is very important at that point in time, and it's important throughout the life. So you should get the vaccine every 10 years. But if you're getting injured in between and you get deep cuts or anything, you should definitely get a booster 5 years in between, just to make sure that things are being taken care of. And it's also important for new fathers, with Father's Day coming up. Anytime your wife or significant other is pregnant and getting ready to have a baby, getting the Tdap vaccine series, or I say vaccine series, the vaccine itself is fantastic because it protects you and your new infant. As we start to get later in life, the 50s to 60s area, the shingles vaccine becomes one that we always recommend. With the shingles vaccine, if you've had chickenpox as a child, or if you're prone to shingles, even if you've had an outbreak before of shingles, it's very unpleasant and it can cause a lot of issues. But the shingles vaccine is something we recommend because it'll help quite a bit. And then if you have lung conditions such as COPD or asthma, we always recommend to get the pneumonia vaccine early. But if you are a smoker, or even if you are not a smoker and you don't have particular lung issues yet, it is important to get that pneumonia vaccine in your 60s.
Interesting.
And then, as always, we recommend the yearly flu vaccine.
Okay. What does screening for colon cancer entail, and what are the benefits of that? And what age,
So
I
we've
guess?
got Yes, sir. We've got a couple of different modalities to screen for colon cancer. So if you are deemed a low to moderate risk patient by your physician, and that means generally you've been fairly healthy, you don't have a lot of risk factors in your life to developing colon cancer, you don't have a bunch of family relatives that have developed colon cancer, then we have the option of doing a Cologuard test. And so it's a mail away kit. It gets mailed to your home. It'll give you detailed instructions. There is a help number that you can call, and they can talk to a person who will detail to you how to complete the kit. But essentially, what it is you're mailing off a fecal sample, and it will let us as physicians know whether or not there were trace elements in your stool that indicate the possibility of a colon cancer. And most people find that much more pleasant than going in for a colonoscopy to screen for colon cancer because it doesn't involve the bowel prep. It doesn't involve the day off of work and the procedure, which some people can find uncomfortable. With that, if the test is negative, then we can continue using that test every 3 years to screen for colon cancer. And it's a very easy, very quick thing that you can get done from the convenience of your home, just by coming into the office and getting us scheduled with you to set that up. Now, if it comes back positive, then we do have to revert to the older colonoscopy, which is the gold standard for colon cancer screening because it allows a gastroenterologist or a general surgeon who is specialized in looking at the colon to have a direct visualization of the actual lining of the colon to see if there are any spots of concern or any polyps or anything that needs to be taken out. And if they find those things, they can actually remove it, send it off for a sample, and it gives them an idea of what is going on with the colon. Now, we recommend at this point in time, it used to be 50 years old. Now we recommend 45 years old to start colon cancer screening for everyone, except for those who have a first degree relative who developed colon cancer at an early age. So that means if your mother, your father, your brother, your sister, or even a grandparent has developed colon cancer, let's say at age 50, we want to go 10 years before they developed colon cancer. So we need to start screening you at age 40. Or if they developed colon cancer and they were caught with it at age 45, then at age 35, we want to start screening you for colon cancer just to make sure that we're trying to catch it early before anything drastic happens. And it's kind of a general thing with our health is we want to catch things earlier rather than later because if we catch them earlier, we can correct course a lot easier.
Jeez. Okay, what about heart disease? It's one of the leading causes of death amongst men. What can men watch for, and are there lifestyle modifications that can help?
Yes, sir. So there are many things that can contribute to heart disease, even things we don't think of. So making sure that you stay on top of your sugars is a big one because getting that sugar screened on a yearly basis will indicate whether or not we are pre-diabetic or diabetic because diabetes can actually take its toll on the heart. It damages the small blood vessels, makes us more likely to accumulate cholesterol, and it causes more heart disease at a rapid rate. So that's one of the things to make sure we watch out for is our carbohydrate consumption. And a lot of people don't even realize they're getting carbohydrates in certain things. So a lot of the time, things that make food taste good is just sugar. Let's be honest there. And they'll sneak it into anything at the store. If you look at the label at the store at how much sugars is in different objects you buy, you'd be astonished and shocked. Or if you go to your local fast food restaurant or your favorite restaurant, and most of them have posted a nutrition fact on their different meals, you'd be surprised as to how much sugar is hidden in things. And it can lead to the early development of diabetes, which can damage the heart over the long term. Other things are getting your cholesterol checked. We find that cholesterol can be high familially. So if mom or dad had high cholesterol, grandma or grandpa had it, your great grandparents had it, it's more likely that you will develop this high cholesterol issue. It's not a guarantee, but it is much more likely. And if that is the case, we need to get you on a statin drug, which is a cholesterol lowering drug, at a much earlier age, because that long term accumulation of cholesterol, especially if you have very high levels of LDL cholesterol and triglycerides in the body, can cause heart damage, and it can lead to heart plaques building up, and that's what leads to heart attacks. Blood pressure is another thing, because pressure being elevated over the long term causes our arteries and veins to stiffen, and when they start stiffening, they start calcifying, and it's essentially turning into bone. And so it starts to harden off and make things more likely to break off and occlude when we have these cholesterol plaques in there. Um, there's smoking is another huge one. Nicotine in the form of smoking not only damages the lungs, but it damages the blood vessels, and it's not good for the blood vessels over time. And any of that damage turns that smooth lumen into a rougher one that can accumulate bits of cholesterol and bits of plaque, and it leads to long-term health issues.
Is nicotine good for anything? It's just really,
No.
I'm surprised they haven't made a medicine out of it or something like that, because it's been a terror for years and years and years and years, So, but anyway, wow. Go ahead, Brad.
Well, I think we better take our news break.
Okay, doke. Bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Okay, we are back. You are listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning we are talking to Dr. J. Evan Devillier.
All right, doctor, this next question we have for you could probably take the rest of the program and then some, but I'm sure you have a way to help us answer it. And I want to talk about obesity and what you can do to help patients navigate that challenge, because it seems to be a bigger and bigger problem in our communities as we go on.
Yes, sir. And obesity has been a trend, especially in the last 20 to 30 years in the United States, as fast food and eating out has become more convenient. We have moved from a more agrarian manual labor lifestyle to a more sedentary office lifestyle. And one of the bigger things with that is try and teach yourself to cook at home. One of those things that I advocate and I'll tell friends is learn how to cook at home. And I tell patients this as well, because you know exactly what's going into your food if you are the one that's preparing it. And you're also going to be more conscious as to, oh, well, maybe I don't need as much of this as I thought I did. Eat with a smaller plate. The fuller the plate looks, the more likely your eyes are to be satisfied with the amount of portions that you're getting. One of the better things I can advise to patients who are looking for a healthy diet is, in this area, there is a heavy Greek population. The Mediterranean diet is a fantastic diet. It is very healthy, very sustainable long term. And if you're not as big on Mediterranean food, I'd encourage people to look up the DASH diet. The DASH diet is a cardiac safe diet. It's heart healthy. It's generally good for diabetes. It's good for a lot of things, but it can also help us trim down because we'll watch portion sizes. And it generally emphasizes a heavier vegetable and protein diet as opposed to carbohydrates. Another thing is finding your way to do at least 30 minutes a day, 5 to 6 days a week of moderate intensity exercise. You don't need to go and lift everything at the gym. You don't need to go and sprint for 30 minutes a day, 6 days a week. It doesn't have to be intense exercise. It can be if that's your preferred exercise, but 30 minutes of walking, just enough to get your heart rate above 100, in that range of like 110 to 120 pretty consistently for 30 minutes is excellent exercise, and it'll keep you moving for the long term. Because one of the things we know is actually just a simple law of physics. It's a body in motion wants to stay in motion. A body at rest wants to stay at rest. So the longer you keep active, the longer you keep in motion, you'll be able to do that throughout the lifespan. pick up an everyday hobby that involves you getting out and being active. Golf up here is a fantastic one. It's a lifetime sport. Pickleball, tennis, those kind of things can keep you active, and it's a lot of people find it much more entertaining. I myself find it much more entertaining than just going running, because you've got a purpose to what you're doing. There's an objective at the end of it, and it doesn't feel as much like, okay, I'm dedicating time to exercise. Other things that are fantastic are gentle yoga, tai chi, things like that. Um, there are a couple of areas out here. Go out dancing, things like that, just to entertain yourself, but that get you up and moving more so than just sitting down and watching TV, are fantastic things.
You know what? Everything adapts itself in our environment and everything. How's come our body hasn't adapted to all this fatty food and sugars and all the other junk that's out there?
Unfortunately, I just think our bodies are not made for all that. And we all succumb to it. I mean, I myself, we all succumb to it. It's something that it tastes good. It gives us that dopamine hit. It gives us that reward of like, oh, this is really nice. Let's keep doing this. We just tend to take it to excess. But another big thing for weight loss is sleep. Make sure you're sleeping good. If you do not sleep, your body does not restore itself. And that restorative phase is what helps us recover from muscle breakdown. It helps us to sort out where our calories throughout the day are going. And it helps with a lot of things, including emotional regulation, blood pressure management, and it can help you just feel a world of difference if you're not sleeping well.
I check my stuff every morning, my blood glucose and my blood pressure, you know. This morning it was perfect. And that's the first time for weeks. Okay. I wish I could make it happen every day. Anyway.
You mentioned, quality sleep. We often get patients in the pharmacy that are having sleep apnea diagnoses. Can you talk a little bit about that and how important it is to seek help if you're not sleeping well, or maybe your spouse is telling you that you're sound like you're snoring a lot or having other issues during the night?
Yes, sir. So depending on your insurance company, and this is something I'm pretty passionate about, is making sure you're getting enough sleep at night. So depending on your insurance company, if your physician does have reasonable suspicion that you are suffering from sleep apnea, we can have the option now to do in-home sleep studies. So the older way of having to go into the hospital overnight, be hooked up to wires, be monitored as you try to sleep in an uncomfortable hospital bed that's unfamiliar to you and is just a task and a half to do, is something that we can skirt around now, because we have these at-home sleep studies that a lot of the time is the equivalent of just wearing an Apple Watch to bed. And so you sleep in your own bed, you sleep on your own time. You're not on someone else's timer that says, okay, well, you've got 30 minutes now to fall asleep. And then you've got to sleep all night, but I'm sorry, we've got something in your nose. We've got probes on your head. We got probes on your chest, on your legs. This is just, okay, put on this watch, go to bed whenever you feel like it. And we'll monitor this remotely. So it's a lot easier to get it checked these days, although some insurances do not allow for that. So the traditional study will be required. But things to look out for are, if someone's telling you you snore excessively loud when you sleep, if you're waking up tired, if you find yourself constantly needing that midday nap, if you have a day off and you're not doing too much, do you fall asleep just in front of the TV real easily? One of the major signs that people notice when they're having sleep issues, aside from just feeling a little more tired, feeling like they just don't have the endurance they used to, men will complain a lot of the time of a headache really early in the morning. And what's causing that is you're not getting enough oxygen throughout the night, and it hurts to not have that much oxygen. Bigger things to worry about with that are, if we are overweight, the more weight we carry, the more likely we are to have sleep apnea issues. One of the things you can look at as a man is most men's dress shirts go by a collar size. If that collar size is getting above a 17 or an 18, and you've had someone telling you, oh, you snore quite hard when you sleep and you gasp when you sleep, or if you even notice you wake yourself up quite often gasping for air, or you have that morning headache right when you wake up, if you find yourself kind of drifting off when you're driving frequently at red lights when you stop and you're like, oh man, I could use a nap. If that midday nap is something you really need, then talk to your physician about this, because we can always run what we call a stop bang score that takes into account your age, your gender, your body habitus, because those are things that make it more or less likely to have sleep apnea. And if you get tested, I encourage you to follow up with your sleep physician or your family physician about this, because we can set you up with an auto PAP, BiPAP, or CPAP, depending on your need. And you would be surprised what a great night of sleep can do for your overall health. It takes a lot of pressure and strain off of your heart, making heart disease something to watch out for. If you have uncontrolled blood pressure, that's another thing to look out for. If you're on 3 medications for blood pressure and you're still having high blood pressure, ask your physician about sleep apnea, because sleep apnea is one of the leading causes of uncontrolled hypertension despite the use of maintenance medicines. And with the treatment using a CPAP, BiPAP, or AutoPAP, we can often get patients' blood pressure down and take them off of medications, which is generally everyone's goal. No one likes to get up and take pills. So if we can get people off of those medications by treating things like sleep apnea and weight, patients do much better in the long term.
Wow, interesting.
Well, we're coming up on our last break here, but real quick, I wanted to touch on you talked a lot about lifestyle modifications for weight challenges and things like that. Is there anything you use or recommend in your practice, depending on the patient's situation, for medication or like a professional program to help patients manage their weight and their weight loss?
So we do have access through the Aultman system to dietitians, which is always fantastic to look at, because we can go and have a patient evaluated by someone whose whole job and whole training is to look at diet and decide what is healthy for the patient's particular needs. Because some patients will say, yes, I'm not consuming all the carbohydrates and I'm not consuming all of the calories, but they're putting themselves at such a calorie deficit that the body is reacting as if they're starving. And so it's trying to hold on to all these calories. And then you've got those that are having excess calories that it's like, okay, we're not as active as to maintain our weight if we're eating 3,000-4,000 calories a day. That 3,000-4,000 calories a day is with someone who's training for a collegiate, a high school activity. That's what your track athletes, your football athletes, your swimmers, they need the excess calories. Otherwise, you just can't fuel activity. But if you're working an office job and sedentary and you're not really getting out too much, you don't need that 4,000 calorie a day. So we need to kind of cut back on those things. Other things they can do is, if you have the option, take the stairs rather than the elevator. Park further from the store than right at the front where it's convenient. And this is all within reason. If you have a disability and you're not able to do it, then try and do what you can at home. Try and do what you can within limitations, especially if you have a disability or you're injured. But if you're able bodied and you have that ability, park further from the store. The walk to and from the car is extra calories you're burning. Take the stairs rather than the elevator. Take an afternoon walk just around the block if it's safe and you're not on a highway or something like that. Those kind of things are fantastic. Joining accountability groups. There are different groups in town. I know there are groups for seniors. There are groups for different ages. Join a local gym like a YMCA or an Anytime Fitness. It'll motivate you. Find someone to go and do that exercise with you, because having someone there for accountability is a great way to stick and build a habit. And it takes about 3 months, about 90 days to build a habit. After you're doing something consistently for 90 days, it just kind of becomes routine and habit, and it feels weird not to do it. So if you can stick to it for 90 days and build that habit, you'll have a much easier time continuing it, which will be good in the long term.
Very interesting. And it is time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White, pharmacist Brad White, and I thank you for joining us. Let's get back to the last segment of the show.
Doctor, one of the things we hear too often in the pharmacy is that patients don't have a primary care doctor. I wondered if you could talk about how important that is, and I maybe give some resources for patients to check out so they can find a primary care doctor.
Yes, sir. And that is a thing that we've noticed a lot more, especially with younger patients. Younger patients generally feel invincible and they don't feel they need to be followed, but it is important to start getting followed by a primary care doctor earlier, because we can check those routine screening things that, as we've said, you may not notice because it's just silent and doesn't cause symptoms at this point in time. But if left unchecked, will be a lot harder to control and a lot harder to go ahead and get treated for, such as blood pressure and cholesterol. Good ways to find a primary care physician, or just run a Google search. I always recommend, if you're in this area, to look at Aultman Health. We have primary care providers in many areas, from North Canton to Canton, Louisville, Alliance, Orville. We're all over the area, and you can always find someone that is available, and not every physician has just this massive wait list to get in. And it's good to start getting checked as early as possible, because there are things that we need to keep track of for our own health and for our own longevity.
Very good. Can we touch on diabetes briefly and what signs and symptoms to watch for?
Yes, sir. So, in terms of diabetes, if you're noticing that you're starting to lose a lot of weight and it's not an intentional exercise and healthier diet related loss in weight, if you notice that you're becoming unusually thirsty, if you're having to use the restroom and go urinate quite frequently, if you're having to wake up 4, 5, 6 times a night to urinate, if you notice that you're getting fatigued very easy, those kind of things kind of tip us off that there could be something going on with the metabolic system, and it could just be excessive sugars. If you notice that you're older and your vision starts to blur a lot quicker than it should, or if you notice a tingling pins and needles sensation, especially on the bottom of the feet or on the palms and the bottom side of the fingers, those are things to look at and say, okay, that's not quite normal. And hopefully we catch these things, if you're following on a yearly basis, before they happen, because we don't want these things to happen. Because a lot of the time, if we develop neuropathy, which is what we call that pins and needles sensation, it can often be permanent, and it can be something we just have to put a patch on with medication, more or less. Whereas if we caught the diabetes early and we got the sugar under control early, we could often prevent this from even happening.
Wow, interesting. How about vitamins? Okay. Are there any vitamin supplements you recommend for men?
So for men, I'd recommend actually avoiding vitamins with excessive iron in them. Most men, unless you have specifically been tested and you were told that you are iron deficient, most men have plenty enough iron. Most men are going to eat a protein heavy diet as it is. Most men are not losing a significant amount of blood on a routine basis so as to need iron in their diet. And a lot of our iron is a vitamin added supplementally to their diet, because there are things like iron fortified milks and cereals and foods that we consume on a regular basis that have plenty enough. So I advise men, if you're looking for vitamins specifically at the store, avoid ones that have iron in them, because it's likely not needed unless your physician tells you specifically you need iron. Vitamin C is always something good to take. I recommend my patients, not specifically that, oh, hey, you have to go take a vitamin, but if you don't like fruits and vegetables that are high in citric acid, then yeah, you may need a little bit of vitamin C here and there. If you're vitamin D deficient, then yes, I always recommend taking a vitamin D supplement. As we start to get older, fish oil is a good supplement to take in terms of the omega red or the krill oil, the omega 369 oil. It's good for just general health and heart health. Those are the main vitamins I'd recommend uh, taking, but a lot of them can be gotten from eating a healthy, varied diet. A lot of the fish oils, if you eat if you eat salmon and tuna and these fattier fish that are plentiful enough, then those are things that you don't necessarily need that vitamin as often. Or if you're eating, as I've said, the fruits and vegetables with citric acid, so your oranges, your lemons, actually peppers are a great source of vitamin C. Those kind of things will supplement that vitamin C level. If you're getting outside most of the year and you're allowing yourself to be exposed to the sun in safe and healthy ways, you're getting a lot of that vitamin D. If you're drinking whole milk that's fortified with vitamin D, you're getting a lot of that just naturally in your diet.
Very interesting. What about testosterone? Should men have a testosterone checked?
So it's not something I routinely suggest unless you are having symptoms that are specific to low testosterone. So if you're noticing a lack of libido, if you're noticing a lack in performance, if you're noticing a lot more fatigue and a quick drop off in your general muscular endurance, a lot of people will notice it because they're getting fatigued very easily. They feel well rested after sleeping at night. They're getting plenty enough good sleep, so we've ruled out sleep apnea at that point, but they're still getting that muscular fatigue to say, oh, I do a manual labor job or I do an office job. These are routine things that I do, but I notice just over the last few months it's gotten harder. It takes a lot more energy to do that. Things like that, or we'll start looking and seeing, okay, is the testosterone adequate? And we do offer testosterone replacement therapy.
I'm thinking we're getting a little tight here, aren't we, Brad? What is hypertension and the importance of evaluating it?
So hypertension is high blood pressure that most people know of. It's a silent killer. It's one of those things that has led to a lot of research, and we want to keep that blood pressure below 130 over 80. So one of the things I tell my patients to do is if you're at a store and you notice the pharmacy has the automatic blood pressure cuff you can sit at and check your blood pressure, sit down for 4 to 5 minutes, relax it there at that little stool at that bench, and then check your blood pressure. See what your blood pressure is when there's no pressure around the situation. Unfortunately, a lot of patients will come in and they have white coat hypertension, which is being in a physician's office, being in such a professional setting makes people nervous. As you get nervous, your body tenses up and your blood pressure tends to falsely elevate. We always recommend checking your blood pressure at home. Any kind of check is better than nothing, but if you're concerned about your blood pressure from a check at home, bring whatever device you're using to check at home into the clinic, and we can always check it against our device. A device that checks from the upper arm is going to be much more accurate than a device that checks from the wrist because there's a lot of bones in the wrist. And if you place it wrong, you're actually checking the blood pressure of the carpal bones in the wrist rather than the blood vessels that run. So we always recommend going with the upper arm because it's going to be a much more accurate, much more central blood pressure.
Well, doctor, how about you let people know who are listening today where they can find you and where your office is at? Because we're about out of time.
Yes, sir. So you can find me through the Aultman website. I'm with the Aultman Alliance family practice of Aultman Orville Hospital, which is a bit of a mouthful to say. But if you are in the Louisville, Canton Alliance, Sebring, Salem area, our office is on State Street, right next to the Aultman Alliance Hospital. It's at the corner near the Rite Aid. And we have 10 providers here that are all fantastic, and we are always willing to take on any patient.
WHBC AM.
Okay, we done?
Yep,
We got a lot-
go
we
ahead and
got-
close
we-
her up.
We got a lot more to go.
Yeah, it's good stuff.
Okay, very good, Doctor. Thank you to our special guest, Dr. J. Evan Devillier. I suspect you have a medical issue. Please contact your healthcare provider. Thanks to Aultman Health Systems and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on Newstalk 1480 WHBC. Thank you very much, Doctor. It was very good.
Yes,
Thank you,
thank you very
gentlemen.
much.
Yeah.
Have yourself a wonderful day.
Yes, sir.
You as well.